14th, 2021, and the school committee is now meeting. The town of Littleton began conducting remote participation Zoom meetings pursuant to Governor Baker's emergency order suspending certain provisions of the open meeting law on March 19th of 2020. Since that time, unanticipated legal concerns relating to the open meeting law have been brought to our attention by the town clerk. Those concerns were supported by the Attorney General's office and confirmed by town council. One concern is that the chat function allows a parallel text conversation to a board's public meeting. Chat is essentially running commentary that is occurring but is not moderated or followed by the chair. All participants and listeners may not be aware of comments being made because some meeting participants join by phone and do not see these conversations. Another concern is conversations between residents within the chat room which are not incorporated into the public record. In response to these concerns, the town will implement the following changes, which in no way prohibit any member of the public from participating in discussion and sharing information during a public meeting, and will ensure that all listeners and participants have equal access to this meeting. People that join the Zoom meeting are set so their microphones are muted. If you called in by phone, please use *6 to mute or unmute your phone. So that the meeting can occur in an orderly fashion, we ask the people who join keep their microphones on mute so background noises do not interfere with the meeting. If you wish to participate in the meeting, please use the raise your hand function available on Zoom, or if you called in by phone, dial *9, which will activate the raise your hand function. The meeting host will notify the chair of the raised hands, and the chair will determine whether and when to allow public comment. When called upon, participants should unmute and state their name and address. After speaking, we request that the participant return their microphone back to mute. All right, starting with the agenda, we have the consent agenda, minutes from January 7th, 2021, and oath to bills and payroll.
Mike, I'll move that we approve the agenda and the minutes, except for I would like one correction. Lynn Snow caught that the CPAC meeting is not going to be next Sunday the 24th, will be Wednesday the 20th.
Second.
All right, motion made and seconded. Is there any discussion on that motion? Hearing none, I'll remind everyone that all our votes on Zoom are roll call votes. So I'll start with Timolin.
Timolin Rossius, yes.
Brad?
Brad Austin, yes.
Justin?
Justin McCarthy, yes.
Matt?
Matt Hunt, yes.
And Mike Fontella votes yes as well. All right. There are at least two portions of the meeting for input from interested citizens, one now and one closer to the end of the meeting. If there are other opportunities, we will do so as well. But if there are any interested citizens that would like to speak before the school committee, now is an opportunity. Just use the raise your hand function, and Dorothy, our meeting moderator, will get you in front of us.
We do not have any raised hands, Chairman Fontanella.
Okay. Normally we would go to recognition and Dr. Clenchy. Dr. Clenchy is under the weather today and will not be with us. Does anybody else have any recognition that we want to bring forward? All right.
Judy from Judy from LC.
Judy does. Okay, go ahead, Judy.
Yeah, so I just wanted to, Brian O'Neill now works with your tech team, and I just wanted to give him a huge thank you for helping Mark and Mike out at the basketball game on Tuesday night. He came in as a clutch person to help fix an issue. Yes. So huge thank you to the school department tech team and Brian O'Neill.
All right.
We'll be sure to pass that along.
Yeah, and if I could, Chairman, just back to LCTV and Judy, thank you, and LCTV, Mark Curry, and Mike, you, Mr. Chairman, for broadcasting the basketball games. I think it's live streamed, and we have it on recorded as well. So it's been fantastic way to start at a very difficult time. Thank you.
Yep, no, it's fun. All right, we'll move into our presentations. We have a presentation on our adaptive map testing. Beth Steele, are you going to lead us out on that?
Perfect, thank you. So after some conversations, and we heard last week, there's a concern with regards to the pandemic and student progress with learning. And so we thought it would be a good time to share some information about our MAP growth assessments that we do. So I'm here tonight to share some information about that with all of you. So just a reminder that MAP growth is a computer-based adaptive assessment that students take in grades 2 through 8. They take it in reading and in math. And then in grades 9, 10, and 11, this year, they're taking it in reading. That's new this year. That's the first year that we've had those grades take the reading assessment. So when we're looking at this document tonight, we're actually going to start by, if we just focus at the chart, we're going to do this a little backwards, and then I'll go back up to the overview information. So looking at the chart, you see there are 5 columns going across. The very far left column shows the grade level, and then we see the assessment area, reading on top, followed by math underneath it. The middle column is our district-wide 2019 RIT mean. So that's the RIT mean score of the 2019 assessment. And then the next column is our 2020 RIT mean score. And then the final column is actually the normative data, nationwide normative data. And then norms were actually updated in 2020. And so that's the updated data that we have. So when we're looking just at this chart, we're seeing a lot of information here. And so there are 2 really major questions that we had and that we've heard from various stakeholders, right? So one, the first question is, how did students perform in comparison, fall of 2020 compared to a more typical year? And so we took the fall of 2019. And then the second question is, have students made learning progress over the past year? So to answer those 2 questions, we can use this chart, but we can use this chart in 2 different ways. So first off, we're going to look at it by looking at the rows horizontally straight across. And we're going to try and look to answer the question of, how did students perform this year, so fall of 2020, in comparison to fall of 2019? So if we look, for example, at the 3rd grade level, which is the second row down in the data. So you can see that in 2019, the average score for the 3rd graders was 201.4. This past fall in 2020, our average score in the 3rd grade was a 198.1. So you can see that there is a decrease in score of 3.3 points. When we compare that to the national norm, that far right column, the national norm, so where a typical 3rd grader sits at the beginning of 3rd grade, is at 186.62 for reading. We can see that both in 2020 and in 2019, our students surpass the norm data. That is true for all grade levels of all of our assessments. And that holds true for 2019 as for 2020. It's important to note that, yes, we had that decrease of 3.3 points. We also had the pandemic with school closures, changing the way instruction was done. So there's going to be a difference between these 2 years, because the pandemic has hit every single individual, students, children alike, differently in how they're going to be able to gain this information. When we look at, the same can be true for math. So if we look at math, grade 3, for example, in 2019, the average score was 198.7. In this past fall in 2020, the average score was 194.7. And then the average score of a 3rd grader in math is 188.48. So again, a little bit lower this year in comparison to last year, but still above the national norm data, which is a good sign for us. So when we take a step back and we look at this, like I said, all of our 2020 scores are above the national norm data. However, with regard to last year, it depends on the grade level. Some are equal. There are a couple that actually scored higher than the 2019 data. But on average, if we take a step back and we look at all of the grade levels comparatively, in reading, our 2020 scores were 3 points lower on average than our 2019, again, 3 points. And in math, it was 4.1 points lower on average than the 2019. So we acknowledge that there was a decrease when we're comparing fall 2019 to fall 2020. There's a difference. But we have to be careful when we compare that information, because while, yes, we are comparing a typical third grader in the fall with another typical third grader in the fall, we're actually comparing different cohorts here. So we need to take this data, this information with a grain of salt. The second question that we are using this chart to answer is, have the students made progress over the past year? And so here on this chart, the way we're going to look at it is actually at a diagonal going down. So bear with me. I'm going to try and explain this while you're looking at the chart. So if we take, for example, we can stick with that third grade, and we see reading for third graders in 2019, they averaged 201.4. Those third graders in 2019 are now fourth graders in 2020. So we're going to go diagonal down to the right to see their 2020 reading score, which if we do that, we see that their reading score in 2020 was 209.8. We can see that they have progressed, they have learned. And when we compare that 209.8 to the 2020 national norm, which is 196.67, we can see that our students are still above the national norm. So when you take a step back and you do that diagonal down for all of the grade levels, you see that every single grade level has progressed forward. There is not a single grade level that declined or decreased in their learning. And so while we acknowledge pandemic, it impacted everyone differently, we're able to see that grade levels as a whole have been able to continue their learning, albeit at a different rate, but the progress has been seen there. So this chart, a lot of numbers, it's a lot of data to look at. It shows hope, and it shows that our students really are learning, they are progressing. And really this can be attributed to the hard work of our students, of our families, of our teachers. Our teachers are working incredibly hard to make sure that our students have access to high quality learning materials. They're maintaining high expectations so that our students really can continue to progress forward in their learning journeys. So this is the fall 2020 data. We have our winter testing session beginning actually end of this month on January 25th. And so the map is done 3 times a year, fall, winter, and spring. And so we'll continue to monitor this to make sure that we're moving in the proper direction with regards to our map and our student progress. So thank you, Chairman, for just letting me share this information with everyone tonight.
Yep. I'll open up to the school committee to ask if they have any questions or comments. Justin, go ahead.
Thanks, Elizabeth. My only question would be, was there any thought to including 2018 as well, so you could look at a trend? Because as you look at this data, and again, I tried to look at it this afternoon, and I tried to follow along as well. I get the diagonal, and I'm curious if we were able to look at it and include 18. What you're showing is that we're above the national norm and that each grade level improved, but I'm wondering if they improved at a slightly lesser rate than they had the previous year before. Mm-hmm. What the typical pattern is for grade level improvement across reading and math. And, you know, comparing 2 years, there's always some outliers there. If we were to, at a third or a fourth year, we'd be able to see the progression of the grades, and the data might be a little more meaningful. So just some food for thought, and might help us analyze it a little better.
Yeah, absolutely. Thanks for that, Justin. And I think that the being able to compare the 2018 would further show that this year was different, not significantly, but enough that it kind of jumps out at us. But I can add that column in. Thanks for that.
Brett?
Yeah, thanks again for that, Beth. And one of my questions was the same as Justin's. I think a larger sample, so it's not just 2 data points, would be helpful. I guess I have a couple other questions. I do recognize the limitations of these data. It's a snapshot taken at the beginning of the year after disrupted education after a summer. I am glad we're above the national average, but that's not really our goal. I'm glad we are. I mean, that is a goal, but it's not the primary goal. I guess I have a couple questions then. I get you answered one of them in your presentation about winter and spring. We'll get more detailed snapshots or more current information. So my questions are these. One, do we have similar information for high school development? We heard about the AP exams from Keith a couple weeks ago, and that was really encouraging data. I'm just wondering if these data exist. And two, what do you as the curriculum leader, or what do we do as a school if we're noticing these gaps? We had some questions from the community last week. We have questions as a committee about remediation or loss of learning. What are some steps we're taking if we're noticing 1.5 to 2% gap between what we might expect if I understand how you're characterizing the data and what we're seeing?
Yeah, absolutely. So to cover your first question with regards to high school data. So as I said, this is the first year that our high school has used the MAP data with reading. Part of that decision was because of the pandemic, to kind of see it's a valid assessment to kind of see where our students are at. Unfortunately, we don't have past district data to be able to compare with ourselves. And like you said, while it's nice to compare to the national norm, that's not necessarily our number one goal. However, our departments within the high school do have their own department-based assessments in order to see where the students are. And so our ELA department has a department-based assessment that they are using in addition to that to be able to see kind of where our students are and how their progress is.
Is that something they've been using for a while? Will we have historical data for that as well?
We wouldn't have too many years of historical data for that at most, for that specific updated assessment that I'm referring to. With regards to math, for example, the MAP growth is not used in math for the high school because our high school curriculum actually uses a program called ALEKS, A-L-E-K-S. And that is a great program that actually is adaptive, and students are able to interact with that program on a daily or however frequently the teacher kind of assigns, or the student can go in and work with that program. And that is a nice program because there's not 3 times where the students are going to take these assessments. It's an ongoing process. So we're able to really dig into those individually and see where students are with regards to that. For the other departments, there are department-based assessments in order to see kind of where our students are and how they're progressing. With regards to your second question and gaps, we have focused a lot on making sure that students are receiving, if they need interventions, they're receiving interventions that they need. However, we start tier 1, right? We want to make sure that we're serving all students to the best of our ability within the classroom setting to make sure that they're able to get everything that they would need there. Then we identify students that's not working or that's not enough. And we're making sure that they have the proper interventions as necessary, which may include Title I, it may include some pull-out services, but we're making sure that those students receive what they need. And that's done MAP, but also we have other assessments, unit end assessments that can be used to make sure, because MAP is only done 3 times a year. So in between those assessments.
Thank you.
All right. Well, it's similar to Matt. Okay. The only couple comments I have is I appreciate the update, and I think Justin and Brad are right. I think we can wait until we get the winter assessment done, but it might be interesting to. I started doing the diagonal, and it's easy enough to do when you're just comparing 2 data points, but trying to go to 3 or even 4 if we wanted to do it a little trickier. So maybe a little more in-depth analysis after we do the winter one, where we can show the cohort just going across, and we can see if the growth has been constricted because of the circumstances, and if so, by how much might be meaningful. I would say, looking at this first glance at it, one thing I would argue is that even though there's drops, you can't necessarily, because you're comparing 2 cohorts, you can't necessarily allocate all of that drop to the pandemic. There could be other mitigating factors, just the makeup of the cohort, one versus the other. And you would never really be able to tease that out. So I think we just need to just have a caveat there. And then in terms of, I appreciate the explanation about the ongoing assessment and the level of intervention for students, because I would think that as a group, as a public district that is relatively high achieving, that the use of remedial instruction to catch up the group is probably not going to truly be required, that it'll smooth out over years. And obviously the younger learners have more of an opportunity in that regard because they're going to have more years to get smoothed out and very well might be where they would have been anyway, right? The pandemic will just be a distant memory by the time they get to 12th grade if they're only in 2nd, 3rd, 4th grade now. Obviously with the older learners, that's not quite as likely that they're going to close the entire gap. But I think as we think about this, the remedial intervention would be on smaller groups of students that we've identified that might have needed remedial intervention or a more significant level of intervention regardless of the pandemic or not. It's just they might need it for longer. They might need to go, instead of going from 1 to 2, they might need to go from 1 to 3 for a period, get to 2, and then they'll be back in 1, that kind of thing. So I'm optimistic that knowing what our staff is capable of and what our families and students are committed to, that we'll be able to come out on the other side of this, albeit very gradually, and it'll be a concerted effort over a significant period of time, like years, not a semester or a grading period or even a year. And Brad, hold on, I'll get back to you 1 second. I did have a question. Beth, are we assuming that we're going to keep going with the MAP assessments at the high school just because now we have, and are we going to add math in? I think that's it. All I had for that question right there.
Yeah, so we're doing the reading at the high school kind of as a trial year this year to see how.
When you answered the math question because we use that other program.
Yeah. Okay. And one other thing, Chairman Fontanelle, I appreciate you saying the fact of years. NWA, who puts on the MAP assessment, has come out and said that assuming we go back to some sort of with regards to social, emotional, physical norm, somewhat of a norm where students are back in the classroom, assuming that happens in the fall, and that's a big assumption at this point, it's 2 to 3 years before we can officially say that the gaps that the pandemic could have caused will be back on a level playing field. So I appreciate you saying that, it's not going to happen in 1 semester or even 1 school year. It's going to take some time in order to make sure that we're getting these students the information that they need.
All right, Brett.
Yeah, I just want to say one more thing is that while we never want to see, test scores uniformly kind of go down across cohorts, across grade levels, they actually didn't go down that much. My basic math is like 1.5%, 1%, up to 2% in some areas. And that's a remarkable achievement given everything that our students and teachers have been facing. And I think we should just not celebrate that they're not always upward and higher, but that if that's not a tremendous gap, and if you had told us in March that we'd have done everything we've been doing since last March, that we'd have a 1.5% gap, I think I've signed up for that. So well done, teachers and students. Yeah,
I'd like to extend on that point, because one of the points I've been trying to make for quite a while now is the goal is not to be achieving at the same level. We know that's not going to happen. Our goal, our efforts are to mitigate the negative impact, to minimize the negative impact. There will be a negative impact. And looking at this kind of data, I would agree with Brad. You can see that, at least at first glance, and we can take a deeper dive and we can continue to look and not get, too much patting on the back yet. But the initial look seems to indicate that in at least at this level, there has been a significant mitigation of that negative impact, at least to this point. And that should be something that we feel good about on a relative basis, right? The whole goal was never to be in this boat, but once you're in it, you got to do the best you can. And I would say that it's an initial indication that we may have been able to significantly mitigate that negative impact.
Can I ask one more clarifying question of Beth? Beth, so this is a snapshot taken in September and in early October. So this probably, if I'm correct, doesn't reflect much of the new and improved hybrid model and instruction is taking place this year. Is that correct?
Yeah, so the fall MAP testing session was mid-October to early mid-November. So we wanted to make sure there was at least 4 weeks of instruction prior to giving this, but it was small amounts of instruction.
All right, that's a good point. All right, thank you. If we're done with that, we're going to go on to a presentation on the, update on the state mandated time on learning. And Beth, we're going to stay with you on this one.
Yes, perfect. You guys are not going to get enough of my presenting tonight. So the student learning time. We want to make sure that we provide this information out so everyone was aware of it. As you may or may not know at this point, that on December 15th, the Board of Elementary and Secondary Education adopted additional amendments to the student learning time regulations. And this was done on an emergency basis. So the crux really of the amendment was done to establish minimum levels of live instruction and synchronous instruction that districts need to be operating under if they're in a hybrid or remote learning model. And so I'll dive into that a little bit as to what that actually means. So on the next slide, we have listed just kind of the major points of really what do you need to know about this emergency student learning time amendment. The very first thing is that we're currently meeting the requirements of the amendment. This is good news. We're in good shape, which is really good. And I think it attests to the hard work that the task force did over the summer and that the teachers and the families and students have done to make sure that our students are receiving live synchronous instruction. The second thing is that students must have the opportunity to interact with educators each school day. So the students have to have a live check-in with an educator every single day of school. This is really there to make sure that there is a connectedness between students and educators, because we all know that really the connection between students and educators is so incredibly important for their learning academically, socially, and emotionally. For number 3, the hybrid model. So this is currently where we are in the hybrid model. So this really applies to us. We must provide students with access to at least 35 hours of live instruction over a 10 school day period, averaged across the grades. So let's start with live instruction, what that actually means. And so in order to know what live instruction means, we're going to talk first about synchronous instruction or synchronous learning. And so that synchronous learning is learning that happens and is directed by a teacher or by an educator in real time with students. So it could be a live class, it could be a whole class instruction, or it could be small group work. That is considered synchronous learning. A very general definition, I will say, of synchronous learning. And so when we talk about live instruction, having to have 35 hours of live instruction, when they say live instruction, that means a combination of synchronous learning and in-person learning. And so we have to provide at least 35 hours of live instruction over a 2-week period of school. So that's the major crux of this update for us. We are surpassing this. We, on average, as a district, are at 50 hours of live instruction over a 10-day period, which is really good news. With regard to a remote model, and this, again, is because of the way the amendment is written. If we switch to a remote model at any point in time, we then have to ensure that we are meeting this requirement. And so in a remote model, we would have to provide students with access to at least 40 hours of synchronous instruction over a 10-day school day period, averaged across the grades. Again, we're already surpassing this requirement because our average is at 50 hours. The other key to the remote model in the amendment is that we must provide access to synchronous instruction each day. So there is not the possibility of having an asynchronous day of the week, because students need that daily live check-in in some way, shape, or form. A couple of other notes to point out here is that the regulation is legally binding. We have to abide by it. The regulation is for grades 1 through 12. And lastly, the regulation takes effect on January 19th. So we have a couple more days, but for us, thankfully, that doesn't impact us because we're already surpassing the amendment, which is good news. So we just want to make sure that we provide that update for everyone to be in the know as to what the updated amendments were from the department.
All right, thank you. I'll open up to the school committee for any questions or comments. All right, seeing none. I appreciate the update, Beth. I'm sure that was our expectation, that we were exceeding it, and you've confirmed it. That's great. Appreciate that. All right, next on the agenda is our state and local public health metrics update, and Katrina Wilcox-Hagberg is here with us tonight to take us through that.
Hi, everyone. All right, can you see my slides?
Yep.
Probably yourselves. Here we go. All right, so today's data that I'm reporting comes out of the state as of today's reports for both the daily report and the weekly report. So we will start with the state data. So last week, the state updated the dashboard. So I've spent some time trying to learn it and see where they've put all the data that they used to have in very predictable places. These are the graphs of the trends in the 4 main metrics we've been tracking for a while. I filtered the data so that we can see November 1st through January 10th. And I chose January 10th so that the most recent data is complete. In the last couple of days of any reporting period, the data is just not complete yet. So you can see that there's an upward trend in the number of cases, the amount of the test positivity, hospitalizations, and deaths. So things continuing to trend upward in every metric we have. This is the graph of the number of tests that are conducted across the states. And you can see that there was, this is the drop over Thanksgiving. And then we got back to post Thanksgiving, we got right back up to the same levels. And then we had another drop at Christmas, but this was a little longer period of a drop because of New Year's. And now we're coming back out of that. So the week after New Year's, we've returned to pre-holiday testing levels again. So we still are, a week behind in our data. So you can see about a week, maybe a little bit more than that in this end of this graph. But thankfully, testing levels have returned to where we want them to be since mid-December. So this is the test positivity graph for the state. The state is now at 7.5% as a whole. Comparatively, the test positivity rose from 6.6% before Christmas to 7.5% after Christmas. That's an increase of about 15%. And when we think about the experience around Thanksgiving, we had test positivity in that time frame rose from 3.4% to 6.1%. So that was a 79% increase. So the good news is we are 2 weeks past Christmas and the test positivity has not risen as sharply as it did at Thanksgiving. So that is a good sign. Keep in mind that the data is not complete post New Year's, so we still have some time to fill in here to see how the impact of the 2 holidays, what it will do to our numbers. So on the left here, sorry, not on the left, this is the graph of confirmed cases. And they're now doing confirmed cases. These are confirmed with a PCR test, and probable cases are a combination of definitions, mostly are including antigen tests at this point. And a probable case, once having a PCR test, will end up in the confirmed case category. So you can see that the trend line behind the bars of these graphs indicate that we had the dip around Christmas, and then we rose right back up to where we were before. And then it was slower over New Year's again, but again, we weren't having testing happening. And then we've on a rise again. And the last few days, again, these data aren't complete. So we have this little dip down. So the good news is, as you can see, the rise for the 2 weeks post-Christmas doesn't match the same sharp increase as it was post-Thanksgiving. So before Thanksgiving, we had a rate of 29.4, which rose to 50 per 100,000 people. That's about a 70% increase. And this, for post-Christmas, I can't speak to post-New Year's yet, but post-Christmas, the rate went from 58.3 per 100,000 to 78 per 100,000. So that's about a 34% increase. So it increased, and we are at the highest level we have had to date, at least through the fall, or since our lowest point. But the rise that we saw isn't as sharp as Thanksgiving. So that's a good thing.
Trina, can I interrupt 1 second? So
yes.
Just listening to these numbers, it sounds like it was about a 20, the N20 increase was the same post-Thanksgiving, post-Christmas. It's just that we're starting from a higher baseline.
Yep.
Is that fair? Okay. Thank you.
That's pretty fair. Yeah, the 20, it rose by 20, but it's harder to get to higher percentages when you're higher. And again, like we don't have the post New Year's timeframe yet. So we still have some time to learn what's happening. And unfortunately, keep in mind that we also have another 3-day weekend in our future. So that will also impact the data over the next week to 2 weeks. So we have this cluster of 3 holidays back to back that will be slow to roll out to see what the real impact is. Okay, so let me just get back on my notes. So yeah, we've covered everything on this one. So the current rate is 78 for across the state. So while things kind of, they all increased in a slower pace than they did before, there's one little bit of data that has me a little wary and I want us to keep our eyes on. So on the left side of this chart is the number of cases in each age group reported as of today. The number of cases increased 20 to 47%, depending on which age group you're looking at, compared to 2 weeks ago. So the time frame now covers December 27th to January 9th. So when I say 2 weeks ago, we're covering the period up to Christmas, the 2 weeks before Christmas. So, but in this time, the 0 to 19 age group had the largest percentage increase in the number of cases. And they have more people in that age group because it's a 2-decade band. So I'm not talking denominator. I'm looking at the same group before and after. There's a 47% increase in cases. The second largest group was the 20 to 29-year-olds. Now, the state changed how they report. They no longer report rates for each of these age groups. So I can't go back to that graph that I've been showing you guys forever, but they now give us test positivity by age group. And so this graph on the right here shows the trends in test positivity over the same November to January 10th time period. And I have to say that test positivity for each age group has been pretty steady over the months of November, December, even back into October, except for the 20 to 29-year-olds. So everyone else had been pretty much flat for a while. And then unfortunately, in the last 2 weeks, if you see this dark blue line, the 20 to 29 the 0 to 19 age group goes from 16.8% to 18.4% to 19.5%. So that's about another like 20% increase for this group. So we've had a rise in the number of cases and then a rise in the test positivity for this group. So unfortunately, I'm missing a piece of this puzzle to help us puzzle out what's happening. One explanation might be that there's more testing happening in this group, so we're catching more cases. And I know I've heard of a couple school districts who did some voluntary testing coming back the first week of January, which would be in this last period here that would capture this highest point. Also, some schools have started some surveillance testing, so those reports will start getting mixed into the state data. But if you think about it, if increase of testing explain the rise in the cases, these extra 4,000 cases than we had 2 weeks ago, then you would also expect a decrease in the test positivity because you would have more people in the denominator, more negatives. So unfortunately, we see a rise in cases and we see a rise in test positivity. And this is just something that I think we need to be aware of and keep our eyes on. And I think given that testing for schools is changing, this metric's going to change. And we're just going to need to, I'm not saying panic. I'm not saying close the schools. I'm not saying any of that. I just want you to hear, this is something that caught my eye. And given that this is an age group that's in our schools, it's something we need to watch. Okay. So then we go to our town data. Again, the same shading circles. So this is Littleton data as of today. Again, it covers the period of December 27th to January 9th. And we had 69 cases reported in that time period. That is the highest number of cases we've had reported to date. And when you compare it to 2 weeks ago, which was 39, that was an additional 30 cases. So this makes us 8 weeks in the red. So we have that same, so remember post-Thanksgiving, we had the same comparison. This is the one post-Thanksgiving. We had this big doubling effect right after Thanksgiving. So we're having a large increase right after a major holiday. So these are the trends that we do for all of those areas. Again, this last week covers that December 27th to January 9th timeframe. Littleton's rate, like I think I said before, I probably haven't actually, is 50.5 per 100,000, which is 80. It's a lot higher than 2 weeks ago, which was 28.6. Not quite a doubling. It's about 80% higher. For comparison, the rates in the other areas that we tracked increased between 10 and 30%. So we had a larger increase than all the other areas that we are tracking. And you can see that with the slope of our line is at a sharper angle. So this is the test positivity for all those areas that we track. So like I said before, the good news is that the testing levels have returned to the level that we post-Christmas level. However, the data that we're looking at includes a week of depressed levels and a week that we're back to normal. So next week will be different. Littleton, however, had the same, almost exactly the same number of tests that we had 2 weeks before. So we had 1,285 tests and our test positivity was 5.76, which is an increased of 2% over the last compared to 2 weeks ago. So again, Littleton's slope is unfortunately steeper than the other areas that we track. We had a larger rise in test positivity during this time frame. So then I just want to quickly run through, since we are at a school committee meeting, what data the state has produced for schools. And this is the K-12 clusters as reported in the weekly DPH report. As you can see, we were kind of like steady around 30 new clusters week over week, except for the week leading up to Christmas, which was 36 clusters. And then these dates are funny. For some reason, I need to check these dates, but this is the last, this last week, which included the break. It was December 13th to January 9th had 6 clusters. When you're closed for vacation, you're not going to have clusters. Yes.
Just can I ask a quick question? So when they're defining clusters, are they just describing what they're seeing, or are they attributing causation?
They are attributing it to a site where multiple cases are linked.
Okay. Thank you.
I can pull the exact definition for you. And
that's fine. That's not what it was. But thank you.
Yeah, but they've defined 2 epidemiologically linked cases. So there is a connection between these cases in a specific setting. So these are clusters that are arising in school. A cluster can be 2. So,
and a cluster could also be siblings in the same household.
So that is a good question. That's not clear.
Okay.
And actually, if you look at that, I would have expected these numbers to be higher if they were including siblings.
Okay.
So I will dig into that and we'll get more detail for you, but I'm pretty sure they would not include siblings. These are, they would be expected in a classroom or some sort of connectivity within the schools.
Thank you.
Unless they're twins, then I can't answer that. There's not many of those though. So the other thing I was noticing is that each cluster is just under 3 cases in each cluster, but that's based on this most recent data, which is the stuff that happened which had a lot of break in the middle of it. And there's 4 contacts, 4.2 contacts per cluster. So these are the clusters happening in schools. That doesn't seem to be Littleton schools, but across the state, and have been for weeks. And I will check my dates because something looks awry on that. So this is, so all the schools hopefully report to DESE and the number of students and the number of staff who are in person. This is one of those things I was meeting with Dr. Clunchy about back in December and his staff, and it seems like these are very crude capture of the number of students and staff who are cases in the school. So this, and there's not really a good denominator, so I can't give you a proportion, I can't give you a rate. This is just literally a count of the number of cases that arise among students and among staff. So today's report had 523 cases among students and 407 among staff. And you can see the big dip happened over a break, but we basically returned to the same level as before break. So if break wouldn't be there, you would have been flat. And that's about all I can tell you, is we can just get a crude glimpse of which way that's going week over week. So this is probably our most salient data that we have access to. These are the health notification letters we all receive from the administration. So just keep in mind, like we've been saying over and over, that it is known that as community rates rise, so does the chance of having cases identified among our school community. That doesn't mean that it's transmitting in the schools, but that people become cases who are associated with the school setting. And then the more you have cases in the school setting, the more the risk increases of transmission in the building itself. So, and the risk of having people who are close contacts who then might need to quarantine or be out of the building. So this is the graph of Littleton's health notification letters that we get. So the yellow bar is the one remote student that we had back in the fall. Blue bars are those cases that are reported among students and staffs as a unit. They're not separated out. So all cases that are reported. The red bars represent the number of letters that indicate there was a close contact, at least one. I know one of these letters, which is the one right after Thanksgiving, there were 2 cases reported in that letter, but it was unclear if there were 2, each case had a contact. So I just counted it as 1. And then the green bars represent any classrooms that have to go remote, or that mitigation strategy where you have to move people remote for a short period of time. So I've put a box around the 2 holiday periods. Now keep in mind, we still don't have full post-New Year's data for this last period, but so I think we can all remember that after Thanksgiving, we had, the rates were 20.5 to 42.5 in Littleton. And we had a total of 10 cases when we had 3 letters that indicated there were close contacts that had been notified, and 1 classroom had been moved remote, which all those families would have been having to shift their plans. So when I look at the letters that we've received in the last 2 weeks, these do not count those holiday. I threw the holiday ones over on the week of December 28th, since they were not, it's a different week. But so the 2 weeks post December break, we've had so far 7 cases reported associated in the community, but no close contacts and no classes have gone remote to my knowledge. And we still have another day to capture this data, but to me, this indicates there was less disruption. Like I think not only is there cases and there's not transmission happening, but when you don't have close contact, you can't have transmission happening in the schools. So this, to me, in some ways, this is a useful way of seeing this. And if you guys want to see this in a different way, I'm happy to have a discussion with you guys of how to present this in a way that would be helpful. So, mitigation strategies like going remote a week after a holiday, or, our schools have put together a lot of mitigation strategies to help prevent and break chains of transmission in our schools, and which will help slow our spread not only among the students and our staff, but also the community. So there's also been a lot of, I say in the last week, there's been a number of publications that have come out about schools and COVID, and I've gathered them, but I haven't had a chance to do a good lit review yet. So that I'm going to try to keep working on that so that we can learn from the studies that have come out. And then the state's starting a pilot testing program. So one of the things that I've noticed in my quick review of the studies is that there really relying on symptomatic testing that's reported by the state to identify cases. So there's not, it's not that the surveillance testing that's capturing the cases and exploring that experience. And we know that kids are more likely to be asymptomatic, but we don't know if they transmit higher or not. So what the state's testing pilot and the schools that they have announced, once that gets started, hopefully there'll be some data coming out of that so we can actually learn what's happening here in Massachusetts, where we have some pretty standard set of mitigation strategies. So we can learn from that. Hopefully they'll make that data public. And then it's not just our schools that are responsible for keeping our rates lower, but of course all individuals can help by using your mask and distancing and limiting gatherings and avoiding crowds and all those things we keep talking about. But hopefully we can get this to go down. And that is it for today.
All right, thank you as always, Katrina, very helpful. Questions or comments? No, not at the moment. Well, Justin, go ahead.
Yeah, sure. Somebody's got to have something to say after all that. Katrina, thanks so much. I guess my feedback on this is we're seeing a rise in cases, which is exactly what we thought we were going to see, right? It's no surprise. And the more cases that are in the community, the more cases are likely to, the more letters we're likely to get, right, from superintendent and all the principals. And to my amazement, we continue to receive these letters that basically say no close contacts. So I think we need to do a bit of a gut check here to make sure that we're defining no close contacts correctly, because if that's the case, then we don't have a whole lot to be worried about. Their cases are in the community. They're going to come into the school. There are no close contacts. There's no transmission taking place. It's not really as scary as the slides make it, at least in the school setting, if we have an accurate definition of a close contact, in my opinion. Any feedback on that, Katrina? Am I thinking along the right lines?
So I agree with you that I'm actually, that every time we get a letter, there are not as many as I expected at this time of year. So I'm glad that all those mitigation strategies we are where we are right now and not higher. The close contact definition, I know that the schools, from my understanding and talking to Dr. Clenchy and Jim Gareffi at the Board of Health, is that they are all both using the same operational definition, which is somebody who you've been exposed to someone for 15 minutes and within 6 feet. So we're unlikely to see transmission or be even measuring people. We're not asking people to go get tested if they're sitting in the same classroom with someone for more than 15 minutes. And I think because of that, we're not actually, we may be missing cases that are arising in there in just asymptomatic ways. There are studies out there that are showing that it can travel further, it can linger in the air longer, so the more sick people in there. But I think if people are really doing a good job of not coming in when they're symptomatic or getting tested and not bringing it into the building, we're going to be less likely to have close contacts. So what I'm hoping is that families who are sick or have a known exposure aren't even sending kids into the building. So therefore, close contacts aren't happening because those families are taking precautions and not sending kids in. And maybe the experience of the staff and the administration is actually more salient here because I can't tell you whether it's working or not. But it will be very interesting to see what happens when the state starts because even if Littleton doesn't participate, if the state starts a testing program, we're going to probably catch some asymptomatic cases among these group. That might show that, like, if you have a case who's in the building and then an asymptomatic case pops up, you might end up with some more transmission links in the schools that are unmeasured under the current definitions. So it's something to keep an eye on, definitely.
All right, thank you.
All right, any other questions or comments? All right, I do see a hand up.
Yes, we do have one.
Yep. Let's go ahead.
John, please state your name, your street, and your question, please.
It's John Kurzwick, 171 Hartwell. Yeah, you know, one of the things with this data, and it's hard to parse out. So, you know, Ms. Hagberg, her going through the presentation, there are things where you start scratching your head, and you know, I was wondering if is there a way I could just share my screen and show folks? All I would need is a minute. Is that possible?
Not really, John. I mean, we to do that, we would ask you to submit that prior to the meeting.
Okay, fair enough. Fair enough. All right.
But that's fine. If at any point you did want to do that, we would certainly be open to that. But we just
I think I agree with that approach. Anyways, that's probably the fairest way to do it. Yeah. So I figured I'd ask. But anyways, let me just comment on that. So one thing that has been bothering me with the case data significantly, and this is why it's hard to interpret, is the case data has become completely uncoupled from hospitalizations, at least the magnitude, the hospitalizations and mortality. And so when we look at, you know, the presentations and we're looking at the rates of cases going up either in the community or in the school, you know, it's hard to parse out what is being attributed to people doing screening, testing, what's being done via symptomatic testing or diagnostic testing. So, you know, I've been thinking that really what the school board needs is kind of a set of metrics that they can use to better judge what's going on, either in the school or, you know, in the community. And I really think the case data is subject to misinterpretation is the best way I would describe it. So I'll submit a proposal to folks. I've been working on it for the Board of Health, but you know, it's something we have to consider because it is hard to make heads or tails of some of this stuff sometimes. That's my comment.
All right. Thank you, John. And again, please feel free to submit anything that you think is meaningful, and we'll definitely take a look at it.
Thank you, John. Amy Tez, please state your name, your street, and your question, please.
Hi, Amy Tez, 117 Whitcomb Ave. I sent a letter this week, so I don't want to be redundant in asking about implementing remote learning models post-vacations moving forward and considering where we are as a district in getting involved with the surveillance testing. And I wonder if you could talk a little bit more, and if I'm jumping way ahead, I apologize. But if you could talk a little bit more about what we would need to do to be able to participate in surveillance testing, either with the state or any other program that's out there. And then would that be something that we could do soon enough to make the best decisions about the upcoming vacation weeks in February and April?
We are definitely going to look at that in a few minutes.
Okay. So, thanks.
Yeah. And I would ask you to, after we've looked at it and presented it and talked about it, if you have another question, please, or we didn't answer the question, feel free to remind us to get to it.
Yeah, thanks.
All right. Thank you, Amy. All right. Just as an extension of this, we have one slide I just want to pull up that I put together today. That kind of moves in line with what Katrina was showing. Can we just grab that up, Dorothy or Dave? Mm-hmm. So this is just a breakout of the COVID cases among our hybrid students and staff. And I thought it would be interesting to break it out kind of by various periods. So we have the pre-Thanksgiving period where things were terrific and rosy and wonderful on such a relative basis. We only had 4 total cases. We saw that post-Thanksgiving spike, which I defined somewhat arbitrarily as the Monday after we came back from Thanksgiving and through the second Friday after we were back. and we had 12 cases, definitely a spike there. We had some more cases before we went out on break for the holidays. During the remote week, we had 7 cases that were communicated to us. And then so far through this week, we've had another 4. So again, just another way to look at it. We can continue to take a look at this over the next few weeks and see if we get that smoothing effect that we saw after Christmas. After Thanksgiving, and we'll see where we end up. Any questions on this?
Mike, just if I'm looking at this correctly, I guess I was getting more optimistic than maybe the data suggests I should. I was thinking that we had avoided the big spike after Christmas, but it looks like we're talking 11 versus 12.
Correct.
Okay.
Right.
But the remote week got 7 of those when none of those people were in school.
Right. Exactly. That's kind of the way I look at it is, yes, the numbers were, we had a few less, but that was 1 week versus 2 really. And over the 2 weeks, you're right, we're about equal, but over half of the cases, or actually 2/3 of the cases that we had coming out of Christmas, we did being remote, which ostensibly means that we might have avoided some close contact and further infection, maybe not, right? No way to prove a negative, but
it's helpful to see it this way. Thank you.
Yep. All right. We just want to follow the agenda. We do have, this is our second section for input from interested citizens. Definitely will allow input from interested citizens after we talk about the pool testing presentation that we're going to get in a minute. But if there's anybody else that has any other comments or business before the school committee, I will offer the opportunity for public input right now.
We do not have any more raised hands.
All right, that's fine. All right, so let's bring up the presentation regarding the potential pool testing programs. So last Friday, we had scheduled, we tried to do this before Christmas and couldn't quite pull it off, but myself and Superintendent Clenchey and Town Administrator Anthony Ansaldi, along with Dorothy, met with Miramis, which is a program, they're a company based in Brooklyn, New York. They have implemented a testing program, a pool testing surveillance program that's being used by several districts in Massachusetts, including Wellesley. It was a good meeting, which we'll go over in a few minutes. And then coincidentally enough, after that meeting was over, about an hour later, Governor Baker announced plans for a state-supported surveillance pool testing program. That's a little different, and we're going to kind of compare and contrast. The Miramis program is a saliva test, and the proposed plan for the state is an anterior nasal swab. It's a short swab. It's not quite as invasive as what some of us have gone through. We can go to the next slide. So I'm going to start by just kind of giving a broad outline of what we've been informed of to date regarding the proposed pool testing initiative by the state for K through 12. Let's go to the next one. What they're proposing is an initial 6-week period for districts to volunteer to participate. And during that 6-week period, the districts would receive test kits, support from a testing service providers, and the testing software at no cost. So the entire cost would be borne by the state. Following that initial 6 weeks launch, any other districts and schools can continue using the pool testing, but the towns would be, or the districts would be required to purchase the tests and any other accompanying test materials and software from a statewide contract. So this would be negotiated by the state, and then each district would pay for it using their federal stimulus dollars. Districts and schools not participating in the 6 weeks launch can use statewide contract for purchasing these services once they're available. The state program pool testing involves mixing roughly 10 to 25 samples of swabs into a batch or pool, and then testing that one batch with a PCR test. The test would be performed once per week on an anterior nasal short swab, and results would be delivered in approximately 24 to 48 hours. The samples can be administered by any trained school staff, and they did say that students in certain age groups could take their own samples under supervision, which they implied would still be by the district. If a pool test result is negative, then all individuals within that pool are presumed negative and don't have to take any other actions. If a pool test results is positive, then all individuals in that pool are retested individually. They're calling that reflex testing. They are recommending that, or part of their program will be the Abbott BinAx Now Rapid Point of Care Antigen Test would be the primary source for this individual follow-up testing. The testing service provider would provide onboarding and continued training, lab processing, and a secure system for transmitting and reporting data and customer support. The schools and districts, let me just go back real quick, sorry. Schools and districts would be responsible for the coordination and administration of the program, overseeing the operations on a daily basis within the district, and conducting the actual follow-up tests on any positive pools. Statewide contract that they're negotiating for the pool testing service is currently in development, but they're projecting about $5 per swab. That would be the minimum cost. Testing service providers would manage the operational logistics for the delivery of the test, the testing hardware, and the coordination and communication with the testing laboratory. And they would handle the tech software associated with the testing, as well as training for school and district personnel and customer and service support. In most cases, they're asking the districts and schools rely on their own in-district personnel or contracted providers to complete the following services: managing the testing logistics, test administration, data entry, software management, administering the specimen collection to students and staff, and administering any necessary follow-up tests with the Abbott BinAx Now test, and transporting the test to the laboratory for processing, typically once a day. They are offering if a district or school does not have the internal capacity or personnel to handle those daily logistics, they could purchase following services from, and again, a statewide contract for an on-site testing coordinator manager and administrators and specimen collectors and staff to additional resourcing for staff to transport the tests to the laboratory. So what they're asking is that prior to the implementation of pool testing, you have to meet specific preconditions. You have to have appropriate PPE for administering the tests, proper authorization and consent from all staff and students to participate, that want to participate in the testing, and a system to offer that second level of reflex testing for any individual students or staff that were in a positive pool. And once those preconditions are met, DESE will confirm that a district or school is permitted to begin pool testing in this program. You do have to obtain consent for participation, consent to participate with the actual swabbing, consent to transmit student information via the tech platform, and consent for any necessary follow-up tests. And they will provide the sample authorization and consent form for districts that want to try to go down this road. In terms of the follow-up testing for positive pools, the districts and schools have to have a process to individually test students. Follow-up testing must be established prior to the administration of pool testing, so you have to be ready to handle doing that second level of reflex testing before they'll allow you to begin the initial testing at the pool level. The Abbott BinAx Now Rapid Point of Care Antigen Test will be the primary source for that follow-up testing, and districts and schools need to consider where this testing would occur. So for this program, by tomorrow, you have to indicate initial interest in participating in that first 6-week, I'm not calling it a pilot necessarily, but that's effectively what it is. At that point, there would be an assessment of district resources to determine which services will be purchased from the statewide contract, and DESE would send final approval to those who can confirm participation, and support for the prerequisites would begin immediately. There wasn't a lot of data on the actual dates about, as subsequent to January 15th. If you say you want to be in and you meet the preconditions, that's still being fleshed out. Go ahead to the next slide. So now it's going to give an update on the Miramis program. So this is, again, pool testing, surveillance pool testing. It is a saliva test.
Hey, Mike, I'm sorry to interrupt.
Yep.
If we have clarifying questions, do you want us to wait till the end or ask them now?
You can ask them now.
I just had two real quick ones. It wasn't clear to me. You said districts that meet those criteria will be permitted to begin. Does that mean all districts who meet those criteria would get the 6 weeks paid for, or is that an application process? Do we know?
So the way I asked Dr. Clenchey that question, he said it seemed that the state was indicating that anybody that wants to get in on those first 6 weeks that qualifies will be allowed in. It wouldn't shock me if everybody jumped in. They had to say, whoa, sorry, we don't have that many tests. But I think they're anticipating that not everybody's going to be ready to jump in right away, because they might not be positioned to be able to go that fast. But he basically indicated that if, for instance, if we thought we wanted to do this, we could indicate our willingness to participate, and should probably assume that we would get in, assuming that we met the prerequisites.
Mike, would you like me to speak to that a little bit?
Yeah, sure, Lynn. Go ahead. Lynn was part of or listening in on a presentation of those slides. Go ahead, Lynn.
And I did submit the survey to indicate our interest in participating. It's non-committal, just like the Binax Now rapid testing. We also did indicate our interest, and we are in the process of being able to participate. So we are in the process of the precondition. So if we wanted to move forward with this, we could, if we were a district that is selected.
Mike, I can save my questions if you want to.
Okay, that's fine.
Mike, one quick question. The $5,
Yes.
the $5 that was mentioned I think the terminology used was per swab. So is that actually per student, or is that per pooled test?
No, that's per swab. So if you have a 25 swabs put together into one pool, it would be $125.
Okay.
Is the way to think about that.
Yeah.
Okay.
Can I ask my follow-up question is relevant to that point? So if a student say there is a positive test in that pool of 25, or they get the rapid test, which is more individualized, what happens to those 25 students? Are they presumed all possible positives? Do we treat them like
yes?
They're all presumed positives, but we could, because we have the potential to participate in the Binax Now, we could use the Binax Now rapid test as the second phase test.
And do that almost immediately, or
and that has no cost associated to it right now.
Okay.
But no cost that we know of, right? The assumption is there would be a cost. We just have no idea what it is. That wasn't communicated to us.
Well, districts who are participating in the free Binax Now, which we're one of those districts, we just haven't ordered test kits yet. We would be able to use those. So parents wouldn't necessarily have to be sent out to get their children tested.
Right.
Thanks, Mike. I'm sorry to interrupt.
Okay, no, that's fine.
Mike, just to clarify then, so when are we going to test these kids? Like if there's 25 kids and staff in one pool.
Let's go through the rest of the presentation.
Okay, so you don't worry about that. If we're gonna test 25 people in one pool, are we gonna have kids and staff missing days of in person? Like, I'm just afraid that if we have 25 people thrown into a pool.
The goal would be to do the second level testing the next day after you've been notified that you were positive. And if your antigen quick response test shows negative, you're in school that day.
Okay. Thank you.
All right. Let's bring that presentation back up. All right, so Miramis is a saliva test. We can go to the next pool. Saliva-based, they talk about their high throughput, high sensitivity, high specificity. It is a PCR test. The sample is self-collected, and there's a rapid turnaround for time results, which we'll see more detail on. So go ahead to the next slide. So the idea is that you collect these saliva samples at home. The students and staff bring them back to the district. They're collected. They're put into pools of 24, up to 24. You can do less, but to maximize your cost effectiveness, you would want to do 24 tests as often as possible. If there is a positive result in any of the pools, what they do is, using the same sample that you have already provided, because what they do is when they do that burst test, they pipette a little bit of the sample out of your tube and combine it with 23 other people's. If your pool tests positive, they'll go back to the 24 samples and pipette out a little bit more, and they break those down into 12 tests of 2 each. So the same 24 samples are being tested again, but they're being tested. Me and Brad get tested, Justin and Timberland get tested, and they'll be able to determine that, hey, the positive result was in Mike and Justin's test samples. They can then, all you have to do is give your consent and some demographic information. They will then pipette a third portion of your sample and do a different type of test. They call it the saliva direct, which will determine, was it Mike or was it Justin, or could be both, who had the positive. And again, you can see here what they're projecting is, after receipt of the test, that first testing, you'd get the results in 12 to 24 hours. If there was a positive test, 6 to 12 hours later, you would get the two or more who might have been, where they would test that sample again in 2 to 6 hours after that. So the total turnaround is somewhere between 18 to 30 hours in theory. We did ask some questions about how well they're able to keep on that timeline, and they seem confident. They're expanding their capacities, but they are getting more busy. So just take that all with a grain of salt. All right, go ahead to the next slide. So the way they do their costing is, it's $480 flat to do that first level of testing per pool. So if you have 24 samples in there, it's $480. If you have 10 samples in there, it's $480. If you have 1 in there, it's $480. So you want to make sure you have 24 in there. That gets your cost effectiveness maxed out, okay? If they retest a pool, that is $960. And that assumes that there were 24 samples in the pool. If there were only 12, that cost gets cut in half.
Mike, is that 480 plus 960, or is it 960 total?
Yep.
It's 960 additional. Okay.
Yep, for any positive pool. Okay. And then if you, you identify which of those sets of 2 had positive results in them, to go to that next level of testing, it's $80 total, $40 for each of the 2 samples. So much different cost structure than we're looking at back with the state one. We'll do a little compare and contrast when we get to the end of this presentation. So basically what they do is they will ship to the district all the necessary supplies for the sample collection. It's basically a tube, glass tube or plastic tube maybe, to store the saliva, a straw to pass the saliva through from your mouth into the tube, and an alcohol swab, and some plastic baggies. And what you do is you put all those pieces into the plastic baggie, you give it to the student or staff member, they go home, they then use the straw in the tube, and they provide the sample, the saliva sample, bring it back. You can put the samples into a FedEx envelope and send it down. Right now, their testing site is in Brooklyn, New York. They are trying to expand their testing capacities, and they are looking at a site in Massachusetts, but that's still to be done. You can ship more than 24 per FedEx envelope. I had the numbers. It was a lot. I think you can get like 200 or more in an envelope. So it wouldn't be one envelope for every pool. It'd be a few envelopes depending on how much we do. The turnaround time from receipt of the tests samples at the lab is, again, 12 to 24 hours. And then they would transmit those. Same thing with the state. There'd be a technology platform for reporting the results. Before you send them, you have to log the barcode. There's a barcode on the tubes. put the person's name, the barcode, and then that way you can track. They're going to report back the barcode's results, and then you can see who it was. All right. Again, this is just showing how you open the packet, put the thing together, pass the saliva through, close it up, put it back in the bag, and bring it to the back to the school. They have a web portal that the school would be using. You would have a designated personnel at the school that would be able to look and see what the results were. It's all online. So that's roughly how that program works. And then what I kind of wanted to do here was talk about some of the similarities and differences between the two programs. The similarities are that they are both surveillance testing. So you can manipulate the size of the testing population, the frequency of testing. It's pool testing, so you're combining samples to reduce the cost and increase the efficiency of processing the samples. Both of the initial testing is PCR-based for both programs. Excuse me, both of them do require administrative resources from the district for things like sample distribution and collection, data logging, results evaluation, and retesting. Some of the key differences, the state-sponsored program is that short nasal swab versus a saliva sample for Miramis. What we've been told is that you don't have to test all schools, but if you do test, if you decide that you're going to test Shaker Lane, you have to test all consenting students and staff in a building each time you do a test run through. Does that jibe with what you heard, Lynn, at the presentation? Yeah, okay. Versus the Miramis, you have more flexibility in choosing the size and makeup of, from your consenting testing population. So, you could do 50% of your population every week. You could do 25% every 2 weeks, whatever you wanted to do. You'd have to think about what is statistically meaningful and cost benefit to figure out, what we could afford to do versus what we want to do. In the state-sponsored program, the samples must be administered or supervised by district staff. Lynn, did they say anything about staff, like teachers taking the test home? Can they do it at home and just bring it back, or do they have to do it in the presence of a district person that's trained to administer the swab?
I think it would impact the validity. We wouldn't want them bringing it home. It would need to be supervised so that we're collecting the pool and knowing that the people that are in the pool are then the samples that are going in that bag.
Okay, so that's something to keep in mind, is that all the samples would be administered and supervised by the district staff. Versus Miramis, the samples can be collected at home. The costing, $50 to $125 per pool estimate for the initial testing on the state program, depending on how many swabs are in a pool. We talked about the $480 for an initial test at the Miramis level. That's up to 24 samples in that test. $960 to go to that second level if you're testing 24, and $80 for the third level testing. The state is indicating that the initial results would be reported in 4 to 48 hours. And it's a same-day delivery of samples to a local lab. And that's what they're talking about, like quarrying, not shipping them through the mail. You would just have someone literally drive them to wherever the location is. Versus the Miramis, they would need to be shipped to Brooklyn, at least at the moment. And then the initial results would be in 48 to 72 hours from the collection, because we have to ship it. Assuming they get it, they start the process. So it's a little bit more longer window just because of the shipping primarily. Once both labs have it, it seems more comparable in terms of turnaround. For the state program, that second level of testing requires a second sample. It's a different test, different sample. That second level of testing is an antigen versus a PCR test. It's quicker, but it's not necessarily as accurate, at least as I understand it. And the second level testing would be administered again by the district. Versus Miramis, the original sample can be used for all 3 levels of testing. All the testing levels are PCR based, and they're all done by Miramis. I don't know if I have another slide. I think that's it, right? Yeah. So at this point, we presented what we know. In my mind, there are plenty of questions that need to be answered and details that need to be nailed down before we would be able to make a confident decision about whether or not this is a good idea or how good an idea or what it would mean to the community to have to be ready to engage in this type of effort. But at this point, I would open it to a conversation among school committee members, and then we'll open it up to public input. Yep, Brad, go ahead.
Yeah, first of all, I'd like to thank Lynn and the administration for getting us in line. It's good to have options, and so I'm glad we're in line. And so we decided to move forward. It's thanks for doing that. You know, the big picture is I've three kind of levels of not concern so much, but questions. It's obviously going to be a logistical staffing nightmare to do this, and I would like to hear from Mike or people who are on the budget committee if it's realistic for us to think that we might even have the budget for this if we decided to move forward. And then the other thing I'm really eager to hear about is from people who know a lot more than I do about the benefits of this, what this actually tells us, and how the data we can get from this will help us make decisions, especially about school model. I will say one thing though, that just before I mute myself again, that appeared that I noticed when I think Tim and I were both asking questions about in the state model, if a group of 24, if there's a positive sample in there, do all of them at 24 have to essentially go remote or quarantine until they get the reflex test? But if the response rate is 24, 48 hours, and we're still assuming we're still in a hybrid model, you know, by the time you get the report back that, hey, these people should quarantine, then they would probably be rotated out of the school building anyway. So we'd have 3 to 5 days to get that second test to administer it. So it may not affect in-person learning as much as I initially feared. I was afraid that, you know, you get one test and suddenly 24 students are remote, or you get one test and suddenly 6 teachers have to be out of the building until they get the next test.
Can I speak to that?
Please do.
Yeah.
So if a pool tests positive, then all of the members of the pool are presumed positive. We get those results. But then if we're able to then immediately test them with the Binax Now Rapid, then we're going to immediately know what members of that pool are actually positive. So once the pool is tested, then kids continue to go to school, and then we get the results, and then we know the pool is positive. And so once we know that pool is positive, we then can move into that second phase. So then individually, we're going to know what students are. And that's really one of the advantages, that there are potentially asymptomatic individuals that we're going to capture within that pool.
Thank you, Lynn.
All right. Anyone else? Justin?
Yeah, thanks. So my initial thought is, at face value, I mean, testing seems like a no-brainer. Let's do it. The state's offering testing. The drive-up sites are at capacity. This must be an obvious thing to do. But when you start to try to think about how we're going to administer it and what's the benefit, and what I'm sure I'm going to get chastised from the public when they want to talk about this, and I'm all ears because I want to learn about as much of this as possible. But it does seem like it's going to be a hard thing to pull off. I don't see much of there's no monetary downside for sort of signing up for the first 6 weeks of testing and just seeing how it goes, and to see if we're able to administer it well, if we get some results that are meaningful, if we're able to sort of try to slow the spread or stop the spread within the schools, all the better. But I am a little worried about, a test popping positive, and then how are those 25 people treated? Certainly you can't have a population of all staff in one test, because then the entire staff would be presumed positive. You couldn't have, a classroom teacher and a helper in the same test, because then they would both be presumed positive. I worry about an overreaction based upon asymptomatic students in the building or asymptomatic staff in the building that's not spreading the virus anyways, as we've seen through the school year thus far, that we might be making a mountain out of a molehill. I'm all ears as to why we should do this, but I'm not 100% behind this just yet.
Can I answer that?
Yep.
So again, going back to the whole pool, if that asymptomatic individual is a student and they're transmitting it to the teacher and they're captured in that pool, then we do know that there's a positive and there's a transmission. I think that's a question that's helpful to answer. And students will continue to be in school. This is going to keep, hopefully, schools and get us faster, potentially, to more in-person learning, because we're going to be able to know what the actuals are. And we're able to, so the BINACs now, there's advantages to that, but that test we were only able to use to test symptomatic individuals. This we're going to be able to, en masse, capture a pool of individuals, but then we're still only acting on the cases that are actually positives when we do that second follow-up test.
Okay, so if a pool pops positive the next day, those 25, they still, like, the kids ride the bus, like.
But they're doing that now.
Even though we know that somebody, we've confirmed that somebody in this population is positive, we're gonna treat everybody the same. You get to ride the bus, you get to do everything until you get the second level of testing.
We know when we know they're positive, we're going to be able to test them. So once we have those results, we're able to then test that pool.
Right. So Justin, they wouldn't ride the bus, and they wouldn't be allowed to
come back midday.
We'd be communicating that pool is then positive, and that then they would be coming in to get the BINACs now rapid test.
Yeah. So it's possible that you're going to receive the information midday, and then go out and get those 24 people and say, hey, you need to come to the nurse for the second round of testing?
No. Yeah, that's possible. But I think what we're truly envisioning is you would find out the night before that you were in a positive pool. You wouldn't get on the bus. You wouldn't go to class. You would come to the testing site to get the second test. You would sit in a chair for 15 minutes, socially distanced, isolated. If it came up negative, you're welcome to come in the building and go home on the bus. And if you come up positive on that antigen test, you're going home for the day until you go through the next level of the protocol in terms of, another test or a quarantine, et cetera.
Okay, that makes sense. So what level of participation do we think we need to make this worthwhile? Because I know that there are probably some people out there that are saying, we're not signing up for this.
Right. Well, that's a good question. I'd like to hold off on that. I think other people have other questions, because I want to make one point too, to the everybody listening in. We are not taking a vote tonight. We are not making a final determination by any stretch of the imagination. My goal as the chair tonight is to see what the appetite is for the school committee to give direction to the administration to get more information and be able to communicate to us and the community, the more details about what are we signing up for if we do this, right? What is the impact? And your question about, what level of participation is a great one. And I think that would be a next level determination about how we do this. I do have some comments about that of my own and that I want to give in a minute after I've heard from everybody else. So I'm not trying to cut you off, but I'm just saying let's just remember what we're trying to do tonight. And if we get to that later in the conversation, that's fine. I just don't want to get too caught up in the weeds, I guess is what I'm trying to say.
No. I get it. And again, at face value, it seems like a no-brainer. But right. I kind of want to hear from the public who might be potentially more comfortable or familiar with this topic than myself. So enlighten us, please, so that we're all ears.
Right. Matt?
I just wanted to ask Lynn, does she think that this is logistically possible? Is it going to put a big burden on the staff, or do you think this is something that we can do with minimal impact?
I don't think the impact is going to be minimal, but I don't think it is going to. I think there's a way that we can approach this. I think some of the advantages is that we're a smaller district, but then there's some disadvantages to that, because if you have a larger district, then you've got more bandwidth to be able to kind of take something like this on. There's a lot of pieces to it. For sure, I will I will say that logistically, there's a lot of planning. So I think really kind of gauging and getting the sense of if this is something that we have the desire to do, then I do think we have the capacity to develop a plan that will make us able to logistically go forward. The presentation that we attended was nice because it was multiple superintendents who are currently doing pool testing presented and gave very honest, transparent presentations about advantages and disadvantages, and there are both for sure. But as far as the efficiency of being able to test the pool, I think that's one of the advantages. And all of the superintendents collectively said that they were able to within 5 minutes get the whole pool tested. So there's not a lot of impact on kids out of class time to be able to test that pool, which I thought was that was a nice takeaway that I got.
John Harrington, I'll get to you in a minute. I just want to see, Matt, are you good? You're muted, bud. You're good. Timlin, do you have any questions or comments?
No, Matt asked mine. Thank you.
Okay. John, I'm going to go to the administration in a second. I just want to get my own bite at the apple here as a school committee member. I agree with Justin. I have a lot of concerns that I don't think that we can reflexively just say, all engines forward. Let's just get this done. We'll figure it out as we go. I don't think that's appropriate. I have some concerns about the resourcing, especially for the state program, because all these samples have to be collected or at least supervised at school by staff, which is significantly different than the way the Miramis test is done. I have a big concern about that. I also have a big concern about us doing that second level of testing, both in terms of it's going to require resources because it's done on site and because it's a second test, right? You're asking people to provide yet another sample. The idea that one sample at the Miramis program gets you 3 levels of testing I like a lot. But I'm concerned about the cost differential between the Miramis and the state program. And I'm concerned about the turnaround time because there's a shipping element to the time frame. I will say that the state program explicitly says that those 6 weeks are free, and then you use your CARES Act funding to, effectively pay for the rest of it. We would be able to do the same thing. We effectively assume, we know that the CARES Act funding that we have still available from the initial funding cycle, that's coming from the second funding cycle that's already been voted on by Washington, D.C., and we anticipate that there may very well be at least a third round of funding by the new administration at some point. Those monies would be available for a Miramis type program, even if it wasn't the state sponsored program. So in terms of having money available, the question is, I would want to do some modeling to see, what the actual dollars are of the 2 programs and what we have available in that CARES Act funding. And we may find that even though the Miramis is more expensive, the funding is available to support it. And, if it's there, we could use it. The other big takeaway I have from the 2 programs is I'm concerned that if we get into the state program, that there's no flexibility in how you test the consenting populations. It's all in. So you got to test everybody every time you do one of the tests. I think there is some flexibility, Lynn, how often you test. Is that correct?
You can determine the schedule, and it is important that it's a consent. Right. So you're testing.
Both programs would be consent based.
Right.
The Miramis program, to your point, Justin, we have total flexibility. We could decide, well, for instance, Wellesley does not test their elementary school students. They test their middle school and high school students, and they test all consenting student-facing staff. But they choose to test all of them every week. That's how they do it. That's how they want to do it. We don't have to do that. We could say, well, we don't want to test the elementary students, but even though we're going to test the high school and middle school students and all the staff, we're only going to do 50% a week. And that affects the cost structure. If we do, 70% a week or 2/3 every week, that affects the cost. So we can model that and see where we're at. And I think it also might make it more palatable. You may be able to get, I would be interested to hear from people that are much smarter and more experienced than I am in this regard. You may be able to get a very similar benefit without testing your entire population every time. There's something that I would want to take a look at before I made a final decision about which way I wanted to go, if I wanted to go at all. I do have significant concerns about the staffing resources. The money, I'm not that worried about. That I want to work it out and model it and make sure that we have that CARES funding available to the level necessary for either program. But I'm more optimistic about that than I am about the staffing. I don't know that we could do the state program with our current staffing level. I would think we have to hire some people and bring them in and train them up and get that capacity there. The Miramis testing, I'm more optimistic that maybe with our current staffing level or with a more minimal addition to our staffing, we could administer that program because the testing, the sample collection is done at home and not on site. So those are my initial thoughts on both those programs. John, did you have your hand up? Did you want to comment on something?
I think Matt, or Brad rather, wants to.
I just had a real quick question, Mike. So you're talking about using the CARES Act funding to support this, but you also mentioned that the state program essentially has an option to kind of subcontract the staffing. Could we use the CARES Act program if we're worried about staffing in terms of people, logistics in terms of people, not in terms of money necessarily? Could we use the money to use basically their provider and subcontract it if that's an option we wanted?
We could, but then the cost is going to get us pretty close to where that near the select program anyway.
Okay.
Right.
All right. Thank you.
To your point, Brad, I think that if we wanted to hire staff specifically for a testing program, that we could we can use the CARES Act funding for that. The benefit of the state program, at least as it's being portrayed, is that they are going to negotiate a statewide contract and make, you know who to go to, right? Here's the phone number. You call them. They're going to send you X bodies. And if we did it on our own, we can't do that. We're going to have to figure out how do we hire people to come in and help us out and do it. So, that is a difference to think about. Mm-hmm. John, did you have a comment?
Yeah, just a really quick, more echoing what you've already said, but you mentioned not wanting to get into the weeds tonight, but I do think just from taking away from the discussion now, I think we really need some additional time to assess the feasibility, capacity, resources, staffing. I wrote down these logistics, the experience in other districts. That was all mentioned already. I think if we took the time to do that with our leadership team as well as with our school nurses, that would be very helpful and informative for the committee.
Yeah, I appreciate that. All right. At this point, before we conclude this and try to reach a consensus about the direction we want to take, I will open it to public input.
I don't see any raised hands, Chairman Fontanella.
There's one.
No, we have one. John Kurzwick, please state your name, your street, and your question, please.
Yeah, it's John Kurzwick, 171 Hartwell. I was thinking maybe somebody else might make a comment for once. But I think, Mr. Fontanello, you hit many of the points about trying to carefully consider what's best. One thing that hasn't come up, and to me, this is where I would say is, for me, it's a value proposition as well. So if it was a little bit of pain logistically, but it got students more time in person, 5 days a week, and if the testing was done right, and that's the key thing, the testing has to be done right and it has to be valid. And there's a lot of pitfalls if you set the testing program up incorrectly. But let's assume you were able to set it up correctly. Now you have the cost of the logistics and the cost of actually running the test and so forth. If all it's going to do is just keep hybrid, you're getting a lot of pain for not much. The question about asymptomatic spread, that's an area of some significant scientific debate still. For instance, we have Dr. Fauci saying asymptomatic spread has never been a driver for any pandemic. Okay, there's a quote from him on that. But yet we got the CDC, who has said asymptomatic spread could be driving the pandemic. I've seen a lot of the data. To me, the data still strongly suggests that asymptomatic spread is low secondary hit rates. When they look at homes, the hit rates are always higher, way higher with symptomatic people. So it all has to be considered. I sent a pretty lengthy list of things that, the people that are proposing this, they really need to, think through. And then one last point, and I'll, step aside here, is it's still not quite clear whether or not this is a screening test or a surveillance test. It looks like I've seen it both ways, and there is a distinction. There is a very big distinction. A screening test is something that you're going to give to an individual to find out maybe if they are positive, and you give this to people that you have no idea really. It's a screening test, so there's a potential low probability that they have it. So you're screening. You're just looking to see. That's one way of doing it. The surveillance test, which I thought I was kind of hearing when you were going through the slides, that's a scenario where you're kind of trying to sample the population to figure out what might be the prevalence within the community. And depending on which way you go, you're gonna make different decisions. So I think that needs to be clarified in the plan that you guys have. But yeah, so please consider the points I emailed, and hopefully we'll come to the correct decision. But as it stands right now, to me, I would not be in favor as it's currently presented. So thanks for the time.
Thank you, John.
Thank you, John. Kathy Olson, please state your name, your street, and your question, please. You're muted, Kathy.
Can you hear me?
Yes, thank you.
Okay. Hi, this is Kathy Olson. I live at 25 Whitetail Way. My question is, what is the bottom line? Like, what is the goal of all of this testing? Are we looking forward to bringing, is this going to get our kids back in school for longer periods of time? Because I don't really foresee this, all the work that would have to be done to do this be worth any value if we're not going to bring our kids, if it's not allowing us to bring our kids back into school.
Right.
Like, I don't understand what the bottom line is for all of this testing.
Right. So I would argue that, or respond that the general idea of the testing is it's multifaceted. One benefit would be that you are potentially catching asymptomatic positive cases that by virtue of catching them, you avoid an outbreak in a school, which increases the number of days that the students would be in the building, not by increasing the number of days they had that we planned on them being in there, but the number of days that they actually get to be in there because we avoided an outbreak. That's the theory behind why you would conceivably do this. And then another level would be, yes, if we think we now have yet another level of mitigation, does that give us the confidence to start to reconsider the current hybrid model and think, are there opportunities to take advantage of this along with all the other mitigation efforts we have in place, to ask ourselves, can we increase the number of days that we're planning on having students in the building and get a benefit from that. So it's kind of multifaceted. I think John just made that same point. Like if you're not going to add the number of days, then this maybe doesn't have as much value as we might think it does, because we already seem to be doing pretty well in avoiding the outbreaks, and maybe this added mitigation effort isn't really going to be that much bang for the buck.
Well, that was exactly what I was just going to say, because we haven't shown any spreads in our schools, and because we are a small school system, maybe, that's a benefit to us. Whereas something like this, these pooling testing is better for a larger, a larger school district. That is showing, that's showing that it's spreading in their schools.
Right. I don't think that's something that I would dismiss out of hand at all. I don't think that's something the other school committee members would either. I think that is a valid point to consider as we try to figure out if this is a good idea.
Okay. Thank you.
All right. Thanks, Kathy.
Lynn, you're muted.
I just want to make one more comment, because Kathy made an important point. And I think right now we need to consider just the timing too, because right now we are in an elevation with coming back from Thanksgiving, coming back from Christmas. I think we need a few more weeks to see if we're able to kind of get that spike back down, because the first number of months of school, we've had very near zero rates. And if we can get back there, then weighing out those variables is going to be really important to see if it is worth it for us to pursue something like this, or if we need to.
Yep. Thank you.
Okay. Amy Tez, state your name, your street, and your question, please.
Hi, Amy Tez, 117 Whitcomb Ave. I just wanted to make a comment that I, in fact, am in support of doing some sort of testing. I think in previous meetings, we've heard a lot of questions and support for getting the kids back into school more frequently, to have more time, more days. And in my opinion, I think while this might be a lot of work and some logistics and financial resource, it would give the district some data to make a real informed decision about whether kids should be in person or in larger cohorts of kids at certain times. And I think given that we don't really have a projected end date of this pandemic, and the level of quarantine and, distance that we have to have socially, really it's our obligation to do the best we can by gathering data. And so while it might not be permanent for us to be doing this pool, testing and data collection, I can't help but feel like suggesting that without some real evidence that we don't have spread, or, the numbers seem to be okay, it's real anecdotal talking and thinking without having some hard and fast information. So I'm really hopeful that, the district will move forward with this and that we can do it pretty quickly, or as quick as we can. I know these things often take a little time to roll out, but I'm looking forward to hearing more about how you would go about doing this and making this decision, as well as to hear about kind of other ways of thinking, to kind of keep the mitigation strategies going. Thanks.
Thank you, Amy.
Carrie Cusick, please state your name.
Brad's got a comment before we jump on that. Brad?
Well, I just had just a clarifying question based on what Amy was saying. Is it true that if we did adopt one of these testing programs, we would have certainly a more complete data set, but also a more timely data set? So instead of waiting, a week or 2 weeks, as we're talking to Katrina about, we're still not getting these numbers, we would have, if not real time, 24, 48 hours of snapshots of our school population. Am I understanding that correctly?
I think the answer is yes, with a caveat of it depends on how many people opt in and what we decide as a strategy for how we want to surveil the population. All right, let's go to Carrie.
Carrie, your name, street, and question, please.
Hi, Carrie Cusick, 3 Silver Birch Lane, right in Littleton. Just calling in, just more of a clarifying question. If we decide to, shut the door on this option for pooling testing, I know you're hoping to give it more time to think about it. Do you know if the state is offering other dates to sort of sign on for it if we decide to pass now, but then change our mind for later?
Yes. So the idea at the moment is that your indication is, do you want to participate in that first 6-week rollout where it's being supported totally financially by the state's funding and not by local CARES Act funding. After that 6-week period, any other districts that want to get in that meet the prerequisites would be allowed to get in. My assumption is, Lynn, did they give any indication that if you didn't jump in the first day after the 6 weeks, you could jump in somewhere else down the road?
So I emailed Lauren Wu just to ask clarifying about what is that 6-week window, because there's no such thing as a free lunch. And when does that 6-week window start and when does it end? And are you going to be able to capture part of it, some of it, none of it? And so if I look at the Binax now kind of testing after we finished the survey, then there was like a week or two. Things progressed pretty quickly after that, after the survey. I think probably not as quickly with this because they understand or are cognizant that there's so much more logistics and planning and kind of infrastructure building that needs to happen to be ready for rolling it out. But I think that question did come up in the chat, and somebody did respond that we'd be thinking February, March. So there's a lot of moving parts to be able to get in line in a short period of time. So I don't know if we would be able to take advantage of the 6 weeks. I'm not sure. And I'm not sure if that was geared more towards the districts right now that are doing pooled testing that are supported by the towns, that they're already kind of set up for that. So it's going to be easier for them to transition. But it doesn't mean that we wouldn't be able to. And I just don't know yet. I'll let you know as soon as I hear back about the specifics about the 6 weeks.
Right. It's a good question, Carrie. And it's one I wondered about too. And I don't want to be over cynical. It was an initial presentation, right? So I wouldn't expect to get all our questions answered and have all the details finalized. I think we need to keep our eyes wide open, though, as we wade into the water to think about what our options are and not get caught in a corner that we don't want to be in, but also not shortchange ourselves out of an opportunity just because we were, more reluctant to go in, a whole hog than some other districts. So there's a balance there, but we'll definitely keep an eye on it, and we'll continue to update the school committee and the community as we get more information and more details. All right.
Okay. I don't see any more raised hands, Chairman Fontanella.
So at this point, I would like to ask the school committee, what direction do we think we want to give the administration? We have 2 potential testing programs. We could tell them to keep working on both. We could eschew one for the other. We could tell them drop it. We don't want to do it. I don't hear that anywhere. What are our thoughts? Brad?
I want more information about both. I know it's more work for the staff, and I'm sorry about that, but I don't think we have enough information to make a decision. We may make a decision not to do it, but I'm still encouraged by the potential and would like to know what we'd be signing up for. And like you said, Mike, I don't model data like this all the time. It'd be really helpful for me to have someone who thinks about this for a living to tell us, a sample of this percentage, this often could give us some information that we could use to make decisions. Because that's what the residents are saying, and what we're all thinking too, is that it would be good to have this information, but we'll have to use it for it to be worth our while. So I'd prefer to move forward and keep gathering information and talk about it again.
Okay. Justin?
Yeah, I think we need more information. I tend to favor the state program. I think maybe just cost-wise, and I think it's probably going to gain more support in the state itself. So we'd be kind of among more players doing the same thing, bounce ideas off one another, compare data within other towns. But I also think we need to take a good hard look at what the pros are going to be of running the testing program. I mean, we're certainly not going to find less cases. We're going to find more. And what do we do with that data? But yeah, and I think at the same time, my other point was, if we're going to gather more information about the testing, let's take this opportunity to gather some information from the other stakeholders in the community and get a survey out there about participation. Because if we're going to get the surveys back and folks aren't interested, my concern is that folks aren't going to be interested because they're in a pooled test. And while they might be making 100% safe decisions, they're going to end up in a pool where there's a positive case, and then they're going to miss the basketball game. They're going to miss, they're going to miss some sort of extracurricular activity, or miss some sort of family event. I'd rather take these tests, send them home, and give them to other people that you're going to interact with without all the social distancing and the masking. I mean, at school, we're pretty safe. But anyways, we should gather more information, but I also think it's an opportunity to gather some information about intended participation within the students and staff.
All right. Matt? Matt, do you have any comments? You're unmuted, so I thought you were ready.
I didn't hear you. No, I would just concur with both Brad and Justin. I would also say that I'm a little bit more, if we're going to do one, I'm leaning a little bit more towards the state myself. But I think, keep our foot in the door, and I think get some more information so that we can make a better informed decision. Maybe we can have Katrina, draw up some charts and stuff that we can look at that might be helpful.
All right, Timlin?
I agree. I don't have enough information right now to make a decision. I'm just nervous about the logistics of it, and Justin just brought up a great point about people being thrown in, that there's some people that are doing the right thing every day, not going anywhere, not except school and home, and they'd miss out on that one thing that they get to do because they're in that pool. Yeah. So I think it would be nice to get more up-to-date data every week instead of this 2 weeks that we're in a lull.
Yeah, so I'm just going to make one comment about that. I think we need to be cautious about how we're presenting that and representing that, because the goal is, if I hear it correctly, is to minimize absolutely the likelihood of people who were in a positive pool missing out on anything. The goal would be to get them right back in the building with the same day they found out they were positive anyway. And I get it. If that wasn't the case, I would say, yeah, that's definitely a concern. But I think the goal is to get them right back. And the other thing to keep in mind is, right now, because we don't actually have data, when something happens, you're going to miss out, and you might not have even needed to miss out because we don't have the test results, right?
No,
so
I know,
we
that's
might have
why
to close an entire classroom or shut a team down because we don't know. So I just think we guys got to be careful about how we're looking at that particular aspect of it. Katrina, did you have your hand up? Lynn, go ahead.
I wanted to speak to that because I think that's an important thing to consider. And I think one of the changes that was nice about the Binax Now program is that initially you needed to, if you tested positive with the Binax Now antigen, it needed to be followed up with a PCR. That changed. So it now doesn't. You don't have to. So a rapid test is acceptable. They've done more research on the Binax Now. The efficacy of it is very, very high. And the immediacy of being able to get the results of the pool and test them, and to have those results in 15 minutes is a better advantage than us capturing a random positive, identifying that there's potential close contacts, and then having to wait 2 to 3 days, because then kids are sent out for a PCR, where the wait time to get tests back right now is still in that kind of increasing phase.
All right. Katrina, did you have a comment?
So thank you for getting all this information. I know there's a lot of things you guys have to weigh. So the goal is to keep our test positives in their schools as low as possible and keep them open. Like, think about those college testing programs where the test positivity is below 1 still, and it's just consistently below 1. And that's because you can catch a case and they don't have time to transmit it to someone else. So you're breaking that line of those chains of transmission. That's the goal. So to do that, I can see 2 different ways here. There's pros and cons to both, and I can see that. But one way to help really narrow in your decisions on what actions you have to do is to be strategic about how you combine your pools. So is that, you know, half of 2 third grade classrooms plus their teachers? Like, then you would have, I know there's something in 3rd grade if it's positive, and then you can narrow it down to who in those 3rd grade classrooms, for example. It might help you really target into those interventions. You know, when that classroom went remote at Shaker Lane and over Christmas, you had a whole group that had to go remote. Well, it might be that they were all fine and we don't know. We don't know if they got tested. You don't know what happened with those families afterwards. So that's an opportunity to have that entire group tested and to know that they're fine and they can stay in the building. So things like that can really help you target your mitigation strategies to the group that you need to focus on. And I get that might mean that somebody misses something they really were looking forward to, and that happens in life for me. But the hope is to minimize the disruption and any close contacts, because then you get out of the close contact game too a little bit. So the hope is to minimize the disruptions and not introduce them.
All right, thank you. I think we need to go a little further down both roads. I have some concerns, significant concerns about the level of support required for the state program in contrast to the Miramis program. And I think we need to really be careful about that. And I also have some concerns about the lack of flexibility for determining how many people we test every week, or every time we test. So I just want to do some more work, and I think we can minimize the information gathering. We can break that out and spread it across some people and not overburden anybody. I will say that I think we need to continue to move as briskly as we can to try to, get further down the road to be able to make a more informed decision. Obviously, on the state program, there are some immediate deadlines if we want to participate in that first 6-week effort. We'll let the administration make a determination or give us a lot of feedback on that. But I think we have consensus that we'll keep moving both of these forward. And I agree with Justin. I think surveying the community at some point, maybe even twice, maybe once, just to get a general impression, and then a second time to get, when we have more details, we can get, maybe think about that. Because it would be kind of foolish to go all this way and find out nobody wanted to do it anyway. Or, we may need to know that, no, there's a hue and a cry for it, and we're going to have to make it work because the community's asking for it. So I think maybe I see one more hand up, Dorothy.
Yes. Crystal Dion, please state your name, your street, and your question, please. Crystal, you're muted.
I am so sorry. I pushed my hand again and I didn't realize it. My phone got hit. I'm sorry.
No problem. Thank you.
Thank you for everything you're doing.
We'll take it. We'll take it, Crystal. Thank you. All right. I think we're good here on that discussion for now. Appreciate everybody's time. It's complex. It's not easy. There's a lot to think about, but we'll get there. All right. At this point in the meeting, we're going to go through our subcommittee reports. PNBC, Timlin, do we have anything to talk about in that regard? Nope. All right. How about the budget subcommittee?
Mike, I did miss the first 5 minutes of that call on Monday night. So if you wouldn't mind sharing any information you feel might be relevant. And then I think there's a follow-up meeting this coming Monday, joint meeting.
Right. So there was a joint meeting between the Board of Selectmen and the FinCom on Monday, and they got an update from Cheryl Hicks Stella, the town accountant, about what where the budget was. She basically stated that the current budget proposals by all the town departments for a level funded, level service budget and the numbers that were put forward can be supported by her current projections for revenue from local tax receipts and state and local aid. So at this point, we are assuming that our initial budget request will be supported. Because there is not a lot of, or at least at the moment in her mind, there's not a lot of changes, really any of the changes that need to be made. They've stripped down the process in terms of each department coming before the FinCom and the Board of Selectmen to justify their requests and trying to prioritize, because they were only going for level funded, level serviced, and it can be supported. Right now, they're just going to talk to a few of the major departments. They do want to talk to I believe to us at some point, and that's all getting scheduled. But really, my takeaway was that we're in good shape, relatively speaking. Our ask was significantly lower on a percentage basis than it has been in several years, but we think we're good with that. Right, Justin and Matt? You guys are the ones who worked it out with Kelly and Steve.
Yeah, absolutely.
Yeah. So, relatively speaking, we're in pretty good shape right now in terms of the budget process.
Great.
All right. Policy subcommittee?
Sure. So, Timlin, I don't know if you want to explain or do you want me to? Okay, thanks. So we met with Kelly and Dorothy and started our policy review. Timlin and I are both new to committee, so part of our time was just understanding how this works and the timetable reviewing policies. The one policy we want to look at with the committee and then also with the town, I guess, right now is updating the harassment policy. It's been 5 years since we've done that. There's been Title IX reinterpretations, I think, of Title IX and new guidance. And so we have a harassment policy that was part of the packet that we want to discuss. But I feel like Timlin and I don't know if Timlin agrees, that it may be useful to wait until Kelly's with us, because part of this is we need to see this from an administrative eye. And Beth could help us with it, but I don't want to put her on the spot. But look at this administrative eye. I think I would. So this is going to be a policy we thought the community might want to read early anyway. It spells out harassment. One of the main differences in this policy and the one that's currently on the books is it differentiates between kind of staff-student harassment and student-student harassment. It's clearly written. This is guidance and language we're taking from the state, I guess, Council of School Boards, and it's all in compliance with the new Title IX stuff. So I guess tonight, I think Timlin and I would just like to alert people that this is going to be coming and probably put on the agenda again for a formal first reading and discussion next time.
Okay.
That makes sense to y'all?
Yeah, I think that's a good idea. Absent Kelly. So, all right, terrific. Thank you. Any CPAC update, Brad?
There's a meeting coming up Wednesday. There's nothing else going on January 20th, so we thought we'd have a CPAC meeting to make the day interesting. And Lynn Snow's gonna be a special guest. It's gonna be an exciting meeting, 7 o'clock. Hope everybody can join us.
All right, awesome. Thank you. All right, is there any other business that we need to discuss or transact? Hearing none, I will entertain a motion for adjournment.
I'll make a motion to adjourn.
I'll second that motion. Timlin got me.
Motion made and seconded. We'll take a roll call vote. Justin?
Justin McCarthy, yes.
Brad?
Brad Austin, yes.
Matt?
Matt Hunt, yes.
Timlin?
Timlin Rassius, yes.
And Mike Fontella votes yes as well. Thank you, everyone. Thank you, LCTV, Judy and Dave, and thank you, Bettina and Dorothy, for supporting the meeting. We'll see you guys all in a couple of weeks. Thank you.
Thank you.